Fact: ICI myocarditis hits just 1% of patients, but kills up to 50%, the deadliest immune adverse event in oncology. From an international registry of over 1,250 cases. Combination ICIs spike myocarditis risk by 3 to 5 times, threatening your patient's survival. Stay tuned to Master Detection and Management with Javid Moslehi, MD of UCSF, to keep your therapies on track. In 3, 2, 1. How do immune checkpoint inhibitors sometimes cause heart inflammation, like in the myocarditis cases you described?
So with a subset of patients who get immune checkpoint inhibitors, we see potential side effects. They may include myocarditis, which is inflammation of the heart itself. It may include pericarditis, which is inflammation around the sac of the heart. You can have inflammation in the vessels, so-called vasculitis. And for whatever reason, we see a lot of arrhythmias, atrial fibrillation, other arrhythmias in a subset of patients. And those are some of the main cardiac toxicities we worry about. The good news is they're fairly infrequent, but the myocarditis can be fairly severe, with some patients actually dying from the myocarditis itself.
What are the early signs of heart problems from these cancer drugs? And why do they happen so soon after treatment?
Yeah, unfortunately, a lot of heart problems can present similarly. Patients can get chest pain, they get shortness of breath, they can get palpitations. These are actually, unfortunately, common for many cardiac issues, including myocarditis. But one of the things that distinguishes myocarditis after getting checkpoint inhibitors, or myocarditis from the checkpoint inhibitors, is patients can also get myasthenia-like syndrome, so they can get diplopia. They can get also myositis, which presents as severe weakness and muscle ache. So those are the things to check. And in terms of diagnosing this, you would check potentially a troponin, which looks for cardiac damage, but also a creatine kinase, or CK, which would look for muscle damage.
How do mouse studies help us learn about and treat heart side effects from immunotherapy?
Yeah, so at my lab at UCSF, we've developed and generated a number of mouse models that we think help us both with the diagnosis of myocarditis after getting checkpoint blockade, but also the therapeutics. In the diagnostic front, the mice have helped us look at new tracers with PET that can more give us better sensitivity and specificity of the myocarditis. And we would come up with new therapeutic paradigms from using these mice and extending this to patients.
What new ways, like special scans or drugs, are being used to spot and fix heart issues caused by these treatments?
So one of the big challenges for us is many of the symptoms or early testing that we do with for myocarditis is not specific to myocarditis. So one of the things we have developed, or we're in the process of developing, are new tracers that then allow us to use PET to image and better diagnose specifically myocarditis. And with specific treatments, we've been able to develop a treatment protocol using abatacept, which targets the T cells, and also ruxolitinib, which is a JAK inhibitor that targets this macrophage T cell crosstalk. And the combination has proved effective in our hands in treating patients with myocarditis. This is a treatment that a lot of people across the world are now using for treating these otherwise very sick patients.